We are going to be talking about adapting CBT based on neurodivergent affirming therapy, which was developed by Julie Roberts in the Therapist Neurodiversity Collective International. More information can be found on the link here and on their website. There are 10 basic principles of neurodivergent affirming therapy. One is to abandon all behavioral compliance-based restrictive and controlling approaches. Advocate, validate, accept autistic and neurodivergent diversity and social intelligence. Advocate for, train autistic acceptance. This can be through play, perspectives, behavior, social communication differences, and sensory needs. Seek to understand behaviors and make sure that these needs are met. These needs can be communication needs, sensory needs, environment, supports, and barriers. Delineate therapy versus a cure, means of self-determined quality of life versus hiding, changing, and eliminating neurodivergent characteristics. Reject normalization of goals that include trauma, autistic masking, loss of autonomy, personal agency, and authenticity. Abandon social skills training goals that shame and lead to autistic masking and poor mental health outcomes. Replace social skills training with neurodivergent affirming social communication assessment and therapy. Conduct respectful, informed assessments. Write evidence-based, strength-based reports and empowering goals. Focus on communication, self-advocacy, boundaries and consent, safe versus unsafe, harmful versus helpful, and acceptance of authenticity. So applying neurodivergent affirming therapy, or NAT, to CBT. So now we're going to focus on some of the basic principles of CBT and how they can be informed by neurodivergent affirming therapy. So CBT uses a medical model focused on curing and treating. Neurodiversity is not something to be cured or treated. So it's important to understand what constitutes neurodivergent affirming practices versus ableist practices, and be able to identify multiple types of naturally occurring social communication traits and behaviors that, when goals are written with outcomes of change or elimination, equate with curative or masking autism therapeutic approaches. Embrace differences. Learn about various autistic differences in social communication styles and monotrophic interest systems, and recognize that these differences are inherent to a person's personal identity. Reject therapy practices that target and induce trauma, autistic masking and camouflage, loss of autonomy, and personal agency. So instead, therapeutic goals should improve self-determined quality of a client's life based on the physical, sensory, emotional, and psychological well-being, wants, and needs of the clients, not on normalization or hiding autism or other neurodivergence or disability. Target self-advocacy, self-determination, and personal agency. Target self-determined client objectives, so what they want to do, that solve problems and needs and achieve the client's personal goals, not the goals of society or parents or friends or teachers, but what the client wants. Any focus on communication or empathy should develop authentic, robust communication in the mode determined by a participant, leading them to meet their needs, wants, and goals. Provide neutral information for navigating social situations, thereby empowering the participant to interpret social situations and navigate them on their own terms. Lead to insight for both the participant and those around them, without the expectation of autistic masking. Model respecting client boundaries. Teach clients that they have a right to say no, to protest, and to provide or withdraw consent. And that includes from you as a therapist. So tell them that they also have options to see other therapists, that if they don't want to talk about something, then they don't have to right now. And all of those consent-based things should especially apply when working with disabled people. Teach participants how to establish and maintain their personal boundaries and the boundaries of those around them. Now we're going to talk about some specific interventions used within CBT and how they should be thought of differently within the framework of neurodivergent affirming therapy. So according to the ABC model, antecedent, behavior, and consequence. So now we want to include in our conceptualization client unmet needs, including sensory needs, capacity, capability, and different styles of communication. So seek to understand why an autistic person may be behaving in a manner that garners negative attention, taking into consideration the person's ability to effectively communicate with spoken language, unmet needs, autistic styles of social communication, autistic play, joint referencing, individual sensory systems, over and under responsiveness, and barriers in the environment. And then figure out how to change the environment, accommodate sensory needs, remove barriers, and implement practical solutions to help the participant meet whatever needs, physical, social, or emotional, that they are not yet able to successfully communicate on their own. Also, sometimes CBT encourages exposure therapy or distress tolerance. We want to not target sensory sensitivities or other aspects like monotrophic interest systems that are innate to neurodivergence or disability as targets for change. These are innate to the person, and it's cruel to identify these as change. And you won't actually change the sensitivities. You'll just make the autistic person or the disabled person look like they're not experiencing the internal experiences that they still are experiencing. Role playing. Do not encourage or reinforce illicit communication styles. So accept and validate autistic diversity and social intelligence. Autistic people share information with other autistic people as effectively as non-autistic people do. Completely abandon training autistic people to perform with neurotypical social skills, as it trains autistic people to mask and camouflage, which actually leads to poor mental health outcomes that include exhaustion, anxiety, depression, negative self-perception, low self-esteem, and suicidal ideation. Autistic masking and camouflaging inhibit authentic autistic communication. And so when we encourage them to do and act within holistic frameworks, we're actually making worse a lot of the mental health struggles that we're trying to reduce. Instead, do focus on self-advocacy, perspective taking, setting and observing personal boundaries, giving and obtaining consent, safety, helpful versus harmful, and the difference between a friend, friendly, and not a friend. These are more in depth of the 10 principles that we started with. And that's the conclusion of this portion of the presentation. Thank you so much.